contribution on the health legislation amendment information sharing bill. Now, we know that last week there was an 11th-hour briefing, and what was to be what, no doubt, and we're hearing in this House, an aspirational bill seeking to do a lot of things, but while government members stand in their places and make a contribution from your talk sheets, what to say, the lived experiences in country rural, particularly a cross-border community and right along the borders of New South Wales and Victoria, every health service that are in that category 1, which have the obligation that when and if this bill becomes achieves royal assent and then becomes legislation, it's the consequential impacts that are going to occur on country and rural Victorians. But look, there was a lot of questions in that briefing, and I thank the Minister for providing the briefing to the Coalition. But I come back and looked at my notes and after the briefing and saw this big red NO on the middle of the page of all these spokes of shooting. And what it doesn't answer significantly is no idea of the total cost of this program, no chance for Victorians to opt out, no indication of additional workload that this will create, no clear idea, particularly no clear idea of how this work will work with cross-border communities. Now, in addition to that, as legislators, the trade that we're in, there should not be a bill anywhere brought before the responsible minister has considered the consequential impacts or the collateral damage that bringing legislation into the Victorian Parliament, what it will have effect on country, rural and particularly border communities. Because every time you brought in a bill in here, there is an effect that just really hurts cross-border communities. So, I certainly think that is worth delivering in policy, and you can laugh along as much as you like. You're in Geelong, yeah, but Jesus Christ. Anyway, moving on. And no way... I didn't hear your question. I'll pull the chain if I want to hear your question. But anyway, no way, and there's no way an individual can find out who has accessed their health data, even under FOI. So there's no dollar figure on this. We don't know what it's going to cost. And why not? I mean, the Minister in a second reading speech spoke about the similar rollouts in New South Wales, Queensland, the ACT and South Australia. I mean, it's a simple answer. What do they cost? I think they've cost a bloody mozza. So anyway, it's not like it's anything new here. It's nothing new in this. You've had a good crack at the bill in previous parliaments. This is now, as we know, 2.0. We're having another go at this again, and still the unanswered questions still remain. Now, with the implementation date of February next year, it seems totally implausible to me that many of the people in my electorate, that you could plan a major rollout without a budget. I mean, give us some, throw us a bone, give us some sort of an idea what's going on. Now, let's talk a little bit about consent, particularly, and I'll quote the explanatory memorandum. New section 134ZL enables the participating health services and the Secretary to collect, use or disclose specific patient health information without the need to first obtain consent from the patients to whom the information relates. Now, if that's not clear enough, precisely, you can't just ignore these important issues that this legislation, and as professional legislators, that we need to consider, because the old saying, the proverbial, it flows downhill. It's the consequential impact of the front line, the effect on our community, the effect on our doctors, nurses, all our clinicians. I mean, this is very clunky, and it's, as I said, aspirational, but you've got a lot more work to do on it. And we saw that when the federal government brought in the My Health records, about 10% of Victorians chose to opt out. Now, if you say that quickly, it sounds all right, but in real terms, that's 700,000 people. It's a hell of a lot of people that have chose to opt out, and it's certainly their right to opt out. Particularly when this goes through. Heaven help me, be scaring the pants off people. I get the intent, to improve healthcare, and it is important, but get it right. By having health providers on the same page, it's fine. But if I don't want to make my most recent visit, and I'll give you a practical experience. Albury-Wodonga Health, 2 campuses, one in Wodonga, one in Albury. Now, the service plan is changing where your acute services are going over the border to New South Wales. I can present myself at the ED in Wodonga, and then they say, no, we've got to step that up and send you across the river into New South Wales. They've been trying to do this for 8 years now and haven't achieved it. They won't have a clue. Even if they put me in an ambulance, and send me over the border for urgent treatment, they'll have no idea who I am, and vice versa. And they've been trying to achieve this for many, many years. So good luck with this if you want to bring this into Victoria. It's just, and we've seen the significant since December last year. Deputy Speaker, we saw security breaches with FRV, Medibank, our Revenue Office, Federal Police, all been hacked, So there's no certainty or guarantee that you can buy your way into someone that's going to deliver the data sets and the information to be able to guarantee absolutely beyond any reasonable doubt that you can protect people's privacy or their clinical information. So, I understand and get that they are justifiably worried about their information. So, as I said, cross-border, it's the only one in the nation. There are certainly some plans and some ongoing negotiations, and I hope that with the local governments of Wodonga and Albury and surrounds, is that the government comes to the table and continues to make for the clinical needs of our communities a much better option. We need more beds. You look at Ballarat, got 700 beds. We're down to, we've only got about 300, but we've got the same size. Geelong. I mean, we put more output than Geelong does. We have more response to the two borders, but the problem is we have the bureaucracy of New South Wales and the bureaucracy of Victoria, the health bureaucracy, don't necessarily talk too well to each other. So heaven help if you want to turn around and bring this in when you have the bureaucracies in the relevant jurisdictions. How in the hell are you going to do that within the state as well? Because the nation is getting smaller, people are going to travel. And like you say, this implementation with, cross-border and all that sort of stuff, heaven help if you want to travel and get interstate as well. But that's not the intent of this bill. But as the nation gets smaller, we need to step it up and make sure that we have the best clinical outcomes right through for not only Victorians but Australians right throughout the country. Now, look, in some ways, I get exactly what the bill's trying to circumvent, and I get all that and the boffins, but you haven't been able to do that. You've got a long history. You've got a rap sheet of a whole lot of failures in IT and that. You've got to own this stuff. I mean, the thing is, both sides of this house, we want to sit down and work with you, but no one has a monopoly on the good ideas. And you can sit there and laugh with your shit-eating grin and all that sort of stuff. Mate,
Order.
It doesn't pop with me, all right? We've got to be the grown-ups in the room, all of us, all right, and get this bloody right. So, anyway, the briefing, whatever things. You can transfer from Albury-Wodonga Health, and you're likely to be sent down to. You won't be sent to St Vinny's or North Shore in Sydney. You'll be likely to be, if you're a New South Wales resident attending Albury-Wodonga Health, you're likely to be sent to the Alfred or the Royal Children's or Monash or something like that. But there's no indication whatsoever that the facts and history, the contraindication with all this is just simply going to have an adverse effect on all of those things. So anyway, I could bump my gums for a bit longer and go on, but please listen to cross-border communities. Listen to rural Victoria. We need better. You need to do better and address it. And no bill in this House should come before the House unless the responsible minister, the Minister of the Crown, has a look at the consequential impacts of what it does to cross-border communities and regional rural Victoria.